Food insecurity is a lack of consistent access to food, nutritious food, for everyone in a household to live an active and healthy life. It could be temporary or it could be long-lasting, maybe due to a lack of availability of nutritious food in a community, like a food desert, or maybe a lack of resources. Food insecurity is a social determinant of health which disproportionately affects racial and ethnic minority groups, as well as socioeconomically disadvantaged populations. Cancer patients are more vulnerable to food insecurity due to the financial toxicity or strain associated with their treatments. 40 to 85% of cancer patients either lose their job, leave their job, or need to take an extended leave of absence. There are out-of-pocket costs, especially for those that are underinsured or uninsured, as well as costs associated with frequent transportation to the cancer center. Unfortunately, cancer patients are much more likely to declare bankruptcy than the average person. Food insecure cancer patients have a lower quality of life, increased rates of depression, stress, and fatigue. They're less likely to complete their treatments or take their medications as prescribed, which negatively affects their prognosis. They're more likely to have post-op complications, and they're also more likely to experience side effects due to poor nutrition. The idea for a hospital-based food pantry came to me a few months into the pandemic when I received an urgent email from our local school district asking for donations for the school food pantry, which was severely depleted. A short time later, a patient confided in me that her husband had lost his job and she needed to stop working due to the frequency of her treatments. She couldn't afford to refill her nausea medication. Last year, with the rate of inflation and gas prices, patients were missing appointments because they just couldn't afford to put gas in their tank. No patient should have to choose between life-saving treatment and feeding themselves or their families. A hospital-based food pantry provides several unique advantages to patients. It's convenient, they're already here, it saves them precious time, energy, and the extra expense of travel. They have access to our wonderful social workers and nutritionists. They know that the food that we're going to be providing is safe and nutritious, and they're comfortable with our staff, so there's no stigma or judgment associated with the use of the pantry. I applied for it and was honored to receive the Kathy J. Peterson Grant to promote equitable healthcare through the NCCPA Health Foundation. The grants are intended for PAs who develop and lead projects which remove barriers to equitable healthcare. We offer a wide variety of foods at the pantry because cancer patients' needs vary depending on their stage of survivorship, personal and cultural preferences, as well as modality of treatment. We have cereals, rice, pastas, sauces, seasonings, low-sodium canned vegetables, canned fruit, proteins such as tuna and chicken. I'm especially excited that in the fall we're going to receive produce from Stony Brook's own rooftop farm. And with the grant funds, I purchased a refrigerator, which will allow us to offer low-fat dairy items, alternative milks, yogurt, cheese, and puddings. There are 3 easy ways to donate. You can visit our Amazon wish list and have items sent directly to the pantry, or you could donate through our Stony Brook Foundation account, or you could host a food drive in your community. Or if you have any other ideas on how you can help, please feel free to contact me. I'd love to speak with you. The pantry is located in our beautiful cancer center right across the hall from infusion and only 1 flight up from our clinical offices.